So guys, you can also, I think, record on your screen and welcome to the first anatomy lab, in which in this lab, guys, will, can you hear me, guys?
دكتور كل شوي.
Yes, in this lab, guys, we'll cover the oral cavity and the pharynx, salivary glands. Of course, when you talk about the oral cavity, guys, as you see here, let us start from outside. Look at here's the upper lip and lower lip, and here is your teeth, guys, so against each other. So look at this space. This space is the oral vestibule. The oral vestibule. Now, this is the space that I was talking about before. Now, let us get inside this alveolar arch, guys. You will see here, this space is the oral cavity proper. This is the oral cavity proper. And guys, you know that the oral cavity proper has a roof, in which the roof here is the hard palate and soft palate. And look at the hard palate. It's formed from maxillary bone and palatine bone. Of course, this is the palatine process of maxilla, and this is the horizontal plate of palatine bone. Now, guys, attached to the hard palate that forms the roof of our oral cavity is the soft palate. And you can see here is the musculus uvula here, or the muscle of the uvula. So this is the uvula, guys. Now, this is about the roof of the oral cavity. And you know that this oral cavity, the roof of the oral cavity, it's a kind of a wall, or like a border between the oral cavity and nasal cavity. So it represents the floor of the nasal cavity, but at the same time, it's the roof of the oral cavity that enables you to breathe and eat at the same time. Now, guys, talking about the floor of our oral cavity, mainly, you know, it's represented or occupied by the anterior 2/3 of the tongue. So this is the tongue, and this is the anterior 2/3, and this is the posterior 1/3. Of course, guys, you know, this is the mandible anteriorly, and this is the hyoid bone here, shown here. So we have a couple of muscles. Some of them represent the floor of the oral cavity, and some of them, of course, related to the tongue. In this cross section, guys, you will see the mylohyoid muscle that represent the floor of your mouth, and this muscle is geniohyoid. But this fan-shaped muscle is the muscle related to the tongue, which is the genioglossus. That, of course, you know, it depresses the tongue and it protrudes outside. Well, guys, you know, there is a transverse longitudinal, of course, superior longitudinal, transverse, and vertical fibers. The internal fibers are not clear here, but it's good to know. Now, this is the posterior 1/3 of the tongue, guys, or the pharyngeal part, because you know the anterior 2/3 is the oral part. It's in the oral cavity. This is the posterior 1/3 of the tongue, which is that known as, what we call it, guys, this part. This is the lingual tonsil. So the lingual tonsil, it's an aggregation of lymphoid tissue, as you know, that represent the posterior 1/3 that you cannot see by the mirror. In between, there is a sulcus here. This sulcus is sulcus terminalis that divides the anterior 2/3 from posterior 1/3. What else, guys? This is the dorsum of the tongue, and this is the ventral surface, which is smooth. Back, guys, this is the soft palate again, and you would see here the palatine tonsil, in which it's not clear here. I want to talk about the folds, but it's not clear here, the anterior and posterior one, palatine arch, I mean, because, you know, anteriorly, here should be the palatoglossus fold, and behind it, the palatopharyngeus fold. However, this is the palatine tonsil that I can see. And okay, here's not clear. This is the oral cavity. Let me show you another, this model as well. Okay, this is a frontal section of the face, in which, guys, this is the hard palate, and this is your teeth as well. This is the mandible on the right and on the left. And this is the maxillary bone, of course. And I was here, guys, to show you the tongue, but in coronal section, not sagittal section. This one was sagittal section, but this is a coronal section. Look at it here, guys. This is the skin with superficial fascia. Sorry. Sorry, guys. So skin and superficial fascia, and this is the platysma. Now, here is, guys, the anterior belly, or these are anterior belly of the gastric muscle. And this is the mylohyoid muscle, the floor of your oral cavity. Small muscles here, geniohyoid. This is the mylohyoid, and this is geniohyoid. And we can see here the genioglossus. And guys, what we can see here is the lingual artery here and accumulated with the vein. So what else we have here in this coronal section? You can see here, guys, the sublingual, I think, sublingual glands, which should be more clear in another model. Although, let me show you here. This is, guys, the tongue again. It covers, of course, this is the floor of your mouth, which is formed by mucous membrane. Now, just here is, guys, below the mucous membrane directly, we have the sublingual gland that opens by 8 to 20 sublingual ducts in the sublingual fold here. So this is the sublingual gland. That's the floor of it is the mylohyoid muscle. Furthermore, guys, posterior to the sublingual gland, we have the deep part of submandibular gland. So this is the submandibular gland with the superficial part and deep part. Of course, the deep and superficial part created as a result of the gland itself traversed by the mylohyoid muscle that divides it partially into deep part and superficial part. From deep part should the parotid should be the submandibular duct emerge, but it's not clear here. So what else we have in this model? Again, two lips, oral vestibule, oral cavity, hard palate, soft palate, hard palate, two parts, maxillary bone, palatine process of maxilla, and horizontal plate of palatine bone. Of course, lined by mucosa. And if you look here, guys, you have the posterior belly of the gastric muscle. Do you remember the submandibular, the location of submandibular gland, which is located in the submandibular triangle. That's bordered by the lower border of the mandible, and inferiorly anterior and posteriorly is the posterior peri of the gastric, and should be the anterior peri, which is not clear here or removed. So this is the submandibular triangle. Furthermore, here, guys, there is a small artery here, which is most probably the facial artery. This is facial artery, most probably. So, but this artery, I'm not sure, this is the superficial temporal or the continuation of external carotid artery. But here, guys, another, here's the styloid process here, and we have two muscles shown here. This is Styloglossus, and this is stylohyoid muscle. Yes, sagittal section, coronal section, which is good to see also. Also, guys, this is a model, which is I would say a good model to the tongue. So here, guys, the mandible and your lower teeth, and of course these are the central incisor and those lateral incisor and canine on the right and the left, and we can see the first and second premolar. Furthermore, you are looking to the dorsal surface of the tongue, in which of course you have mainly three kinds of papillae distributed there, but here is most obviously you can see the palate papillae here, which is just anterior to the sulcus terminalis that should be here at this region. This is the sulcus terminalis, in which anterior to it there's another V shape, which is the palate papillae. You look at the mirror, guys, and easily you can see those kind of papillae. So this is the anterior 2/3 of the tongue, and again this is the posterior 1/3 of the tongue. Let us have a posterior view here. Sorry. And guys, let me show you here. This is the lateral surface of the submandibular fossa and the tongue as well, and the muscles related to the tongue, in which, guys, here's the Styloglossus muscle from a styloid process, and toward the tongue, then it blends with this quadrangular muscle, which is the hyoglossus muscle. So we have hyoglossus muscle, Styloglossus, and we have a fan-shaped muscle, which is the genioglossus, which originates from the superior mental spine and inserted in the tongue. You know that the genioglossus muscle is very important because it depresses the tongue down and protrudes it outside, and it's used to, I would say, to test the hypoglossal nerve. Furthermore, guys, let me show you the other surface as well. So again, this is the submandibular gland, and this is the sublingual. So this is the submandibular gland, the superficial part and deep part. That means that divides by the mylohyoid muscle that forms the floor of your mouth. Now, just anterior to it is the sublingual gland that opens directly. You see these sublingual ducts, 8 to 20 in numbers, open into sublingual folds along each side. Now, guys, also here, look at this nerve. You know that this nerve is the lingual nerve, most probably, because it crosses the parotid duct there. So, yes, the submandibular duct laterally. That's why it is important to know, guys, that the lingual nerve crosses the submandibular duct laterally. What else here? Here's mainly the lingual artery with the vein, right? And what we have also here, something else. Let us have a look here, guys, at this plastinated model in which you see the tongue here and the lower teeth and mandible, of course. And guys, this is the posterior belly of the gastric muscle. Michelle here, okay. Yeah. So in this model, guys, this is the mastoid. I think you know this is the mastoidal process, which is behind your ears, like a nipple shape. Now, medial to it, partially attached the posterior belly of the gastric muscle, and here is the intermediate tendon of it. Very interesting thing here to see, guys. Look at this muscle. This is styloid process, right? Which is related to the temporal bone. From the styloid process, there is a muscle here which is stylohyoid. This is the hyoid. This is the hyoid bone. Look at the stylohyoid muscle. It creates a kind of V shape that encircles the posterior belly of the gastric, which is an interesting landmark here. Look at it. So, again, this is a stylohyoid and this is a styloglossus muscle. Okay, guys, styloglossus, stylohyoid, and posterior belly of the gastric. And I would say this is mostly the mylohyoid muscle, right? And this is geniohyoid. And above the geniohyoid, you have a fan-shaped muscle, which is the genioglossus. Right. So, what else here? Let us, guys, have a posterior view of the nasal, oral, and laryngeal opening. So here is, guys, you are looking to the from the pharynx in the back. So it's good to start with the pharynx, I think, but I have to finish, I think, the parotid duct. So let us leave it now for the pharynx. Let me just finish the largest salivary gland, which is the parotid gland, guys. So, guys, again, this is the, we talked about the salivary gland, although here we have a very interesting view of the submandibular gland before. Look at the, look at here, this is the, okay. This is the lower border of your mandible, and this is the superficial part of submandibular gland, which is, look at this artery that was deep to it, but now it's lateral to it, which is the facial artery. Here, guys, again the facial arch. Okay, here's again the lower border of the mandible, of the body of the mandible, and this is the facial artery, which is a branch of external carotid artery from the anterior branch. I mean, it was deep to the submandibular gland, but then it twisted out and becomes lateral to the submandibular gland, and then arcs over and anterior to the masseter muscle here. Anyway, this is the submandibular, the superficial part of submandibular gland. And what you can see here, I don't like to talk too much about the muscle, but it's something like to the next year. But it's good to know that this is the posterior belly of the gastric, and this is the anterior one, and this is the intermediate tendon. Okay, and here's, guys, the very nice funny muscle, which is the stylohyoid, that splits near the intermediate tendon to enclose it, like V shape. Okay, so let me move it like.
Okay. I'll put it in.
So, guys, furthermore, we have the largest and third salivary gland, which is the parotid gland. You know, this is the parotid region that includes the parotid gland that you see with other related structures known as parotid bed. Now, you know that the parotid gland, guys, like, look at it, is like inverted pyramidal shape. This is the base of the pyramid, and this is the apex. Now, guys, you look at its location, which is just under the zygom, one finger breadth under the zygomatic arch, and anterior and inferior to the external auditory or acoustic meatus. Furthermore, guys, you know this muscle, which is the sternocleidomastoid muscle, which originates from the mastoid process. Anyway, the parotid gland located just anterior to its anterior border. We talk about muscles, then we have to remember the other muscle, guys, which is the masseter muscle. You know, the parotid gland covers the posterior half of the masseter muscle. Furthermore, guys, there are a couple of processes here. This, you know, it's a kind of irregulated, lobulated structure, gland. That means it has a kinds of projections or smaller processes. This one that starts the auriculo, I think, temporal nerve, is the glenoid process. And this one is the facial process. Of course, we have the carotid artery here, and this is the carotid process. The pterygoid process, we cannot see it because you know, guys, that the parotid gland also related to the ramus of the mandible. This is the mandible, and this is the ramus of the mandible. So it's located superficial. Yes. So this is the mandible, guys. So this is the ramus of the mandible. So the gland located superficial, posterior, and a little bit deep to it. It's like a C shape, like a hook. Look at the facial process, and mainly it's not clear here. The accessory process should be here. From there, there is a small, like, emerge the parotid duct that traverse the masseter muscle. The what are you looking for? I think yes. Let's. I think so. Yes. Thank you so much. So, guys, here is another view. This is the parotid gland and the parotid duct that traverse the masseter muscle. That means it's related laterally to the masseter muscle, which is that makes it more prone or vulnerable for injury. So look, follow this short 5 centimeters parotid duct, which is just anterior to the masseter muscle. It pierces the buccinator muscle. This muscle is the buccinator muscle. So it pierces the buccinator muscle and buccal mucosa at the level of upper third molar tooth. So it pierces the buccinator muscle and buccal mucosa at the level of the upper third molar tooth. Then, inside the oral mucosa, it passes a little bit, guys. It passes a little bit to the front inside the oral mucosa. Then it pierces the oral vestibule, the oral mucosa, just at the second upper molar tooth. So keep in mind that it pierces the buccinator muscle and the mucosa at the third, that means in the back. Then it passes a little bit to the front, then it pierces the oral mucosa at the level of upper second molar tooth. Guys, look at again to the parotid duct. It accompanies with one artery and two nerves, or two branches of nerves. Here's, guys, you see now the mostly the branches. These are the branch of facial nerve, which is very important to know, as I mentioned, that the facial nerve passes through the parotid gland itself. So these branches, 5 branches, which is you will take, you will know more about them in the neuroanatomy course, but for now, this is temporal branch. This is zygomatic branch, and 1 and 2 buccal branch. And guys, this is the upper buccal branch, and this is the lower one, right? And this is the marginal branch, and of course, in the neck, there is a cervical branch. So we have 5. Now, for the parotid duct, guys, it accompanies with the transverse facial artery and vein, and superior or upper and lower buccal branch, above and below it. What else, guys? What else? So I was just trying to find, let me show you the plastinated one, which is really nice. Here again, look at the external auditory meatus. This is the face, right? So this is the face, guys. And this is the parotid gland. When from facial process, there is a duct here, which is the parotid duct. Look at the parotid duct that traverse lateral to the masseter muscle. Then it pierces the buccinator muscle here. Guys, listen. Let us define the level of the parotid gland, which is something related to surface anatomy. You know, this is the tragus of your ear, right? This is the tragus of your ear. Now, and this is the upper lip. So just draw a line from the tragus all the way to the upper lip. This line is the, I would say, the oblique line that's parallel to the parotid duct and very close to it. It will be like this. So it's very close to the, approximately to the parotid duct, to the incline of parotid duct. But where is exactly? It's in here or there. Well, this line from the tragus to the upper lip divided into three parts. 1, 2, and 3. So the location of the parotid duct will be in the middle third. Well, somebody, guys, can say, yes, but I need to know where is exactly the emergence point or the exit point or origination, the origination of the parotid duct. Okay, from the gland, of course, this is a parotid gland, the facial process. It is the original point. What you have to do, just again, draw the same line, guys, from the tragus to the upper lip. Then, this one, right? Or from here, I should be here. Then, this is the zygomatic arch. Midway of zygomatic arch, draw another line. So the crossing point, guys, is the location of the emergence or the exit of parotid duct from the parotid gland. Okay, so look at it here, guys. To the facial artery here. This is the facial artery, which is tertious in nature. And facial nerve. Okay. Still, guys, we have the pharynx. Okay, 46 minutes. Okay, let us finish the pharynx, guys, within 10 or 15 minutes, and that's it. So back again to this sagittal section. I'm going to adjust. Okay, guys, this is the nasal cavity again, and this is the anterior nasal opening. On the other hand, this is the posterior nasal opening. Behind the nasal cavity, you know the pharynx, which is the muscular tube, extends up from the base of the skull until the level of the lower border of a cricoid cartilage, or C6. Now, as I mentioned in the theory, guys, that the pharynx is three parts. The part behind the nasal cavity, this part is the nasopharynx, and part behind the oral cavity, which is the oropharynx, and the most inferior part, which is behind the larynx, is the laryngopharynx. Now, guys, this is the nasopharynx, the roof of it made by the body of sphenoid bone and the basal part of occipital bone. And you know, embedded in a mucosa here, guys, is the pharyngeal tonsil, adenoid. Now the floor, as I mentioned, is the soft palate, made by soft palate. Now let us shift to the lateral wall of the nasopharynx. That it has an opening here, which is opening of auditory tube or pharyngotympanic tube. This tube connects the nasopharynx to the middle ear. So this is a tube, right? That means this elevation that you see here is a tubal elevation created by the tube. And continue down, guys. You will find yourself with yourself in another fold, which is the salpingo pharyngeal fold, created by salpingo pharyngeal muscle. So, what else? Tubal elevation. Okay, look at this recess here, guys, between the adenoid and the tubal elevation. This is the pharyngeal recess here. Let us go now inferiorly to the oropharynx that's located behind the oral cavity. Now you will see here, guys, the palatine tonsil that, of course, guarded by two arcs or folds, anterior one and posterior one. Not clear here. It's clear here. So this is the palatine tonsil, and this is the palatoglossal fold, and this is behind it is the palatopharyngeal fold. Both muscles create both these mucosal folds created by muscles, which is palatoglossal and palatopharyngeal, the same name. So in the roof of the oropharynx made by soft palate here, and the floor is made by the posterior 1/3 of the tongue, and the epiglottis. Guys, here's the vallecula here, and just posterior relation, guys, which is also important. You know, in the nasopharynx, you are related, of course, to the arch, anterior arch of C1 or atlas. But the oropharynx, which is related to the C2 and upper part of C3, while from C3, 4, 5, and 6, these vertebrae located just behind the laryngopharynx. Laryngopharynx, guys, bordered anteriorly by the epiglottis and the mucus that covers the larynx, and of course it's located behind the laryngeal inlet. So always you have, guys, a defect anteriorly. So nasopharynx, you have the posterior nasal opening. Here you have the oral opening, and here you have laryngeal opening. Look at the pharyngeal muscle, the coat of pharyngeal muscle. Yes, look at it here, guys. This is the pharyngeal muscle here, and you know that the superior constrictor muscle is not complete superiorly. There's a gap between the upper border of superior constrictor muscle and the basal part of the bone, which is completed by the pharyngobasilar fascia. Again, guys, this is a posterior view for the pharynx. I hope it's clear. So this is a foramen magnum, and forget that. And this is the posterior nasal opening here. And this is the uvula you see here. That means this is the oropharynx, but you look into that from the back. And this is the laryngeal inlet. So we have three: posterior nasal opening up, oropharyngeal opening here, and laryngeal inlet. You know, this is the epiglottis, and this is the arytenoid cartilage with epiglottic membrane, which is something related to respiratory. But I'm going to show you, here's the thyroid cartilage and hyoid bone. So this space is the piriform fossa, right? In which usually foreign particles or foreign bodies can lodge here, and it's more prone for injury when they're trying to take it out, because, you know, of the internal laryngeal nerve, and recurrent laryngeal nerve can be just under the mucosa there. So this is the superior, middle, and inferior constrictor muscles, because they are overlapping each other. And I would say here, inferiorly, you know, the pharynx continues with the esophagus, and I think this is the lower fiber of the inferior constrictor muscle. You know, the inferior constrictor muscle has just the inferior fiber of it, known as cricopharyngeal, and this should be thyropharyngeal. So the cricopharyngeal fibers works as a valve that prevents the ingestion of air or entrance of air during the act of swallowing, right? So this is now the esophagus. Something else؟ فيش نقدر نقول كمان عن الفارنكس؟
Styloglossus muscle.
وين؟
very long muscle. يعني من الستايلويد راح للفارنكس.
بس كيف فوتنا داخل جوا؟
بس مش عارفة.
Yes. Guys, we cannot see the salpingo pharyngeus, and yes, we have three muscles as I mentioned, but the only one here in this plastinated model, this is the hyoid bone, and this is the stylopharyngeus muscle that passes between the superior and middle constrictor in the gap in between. And you know, it's the only muscle, the stylopharyngeus, the only muscle that's innervates by glossopharyngeal nerve, cranial nerve number 9. Otherwise, all the muscles of the pharynx, either the circular or longitudinal, are innervated by pharyngeal plexus. So guys, let us try to explain as much as we can from the plastic model that we have. Look at the cricoid process and the C6. So from C6, the pharynx now continues as an esophagus. Again, it's a muscular tube. And guys, there is very interesting relation, but before that, let me show you the, if we can, the sites of constrictions. So you have one between the pharynx and the starting of esophagus, pharyngeal-esophageal constriction, and you have one where is the arch of aorta, and below it the left main bronchus. Here, guys, here is where is the arch of aorta across the esophagus, and the left main bronchus cross it, and where is the esophagus, whereas the esophagus penetrates or passes through the diaphragm at the level of T10. Now, guys, we mentioned the clinical significance of that, and the distance is here. So the distance will be 17 centimeters and 20 to 27 for arch of aorta and left bronchus respectively, and 44 centimeters to the diaphragmatic hiatus. Now, let us talk a little bit about the relation of esophagus as much as we can here. So superiorly in the superior mediastinum and above, yes, thank you so much. So guys, this is the esophagus here, which is related, posterior to the trachea. This is the trachea, and posterior to it is the esophagus. So the trachea is anterior to esophagus. Keep it in your mind always. And of course, the left recurrent pharyngeal nerve should be here, but this is, already covered in theory. We don't have the nerve shown here. And guys, let us show you here that what is the heart? When you put the heart, guys, you will see that the right pulmonary, look at it here. So the right pulmonary artery, guys, passes to the front of esophagus, but the left main bronchus passes anterior to the, on the other hand, to the esophagus as well. Now the descending or the thoracic aorta, it was, partially posterior to the esophagus, but then it becomes, it was lateral to it, but then it becomes posterior to it. We don't have a thoracic duct, but thoracic duct was relatively in the lower part of esophagus to the right. Then at T5, it crossed behind it and it becomes to the left of it. I think it was a question in the exam as well, in the cardiovascular, about the relation of esophagus to the pericardium and left atrium, in which the left atrium and pericardium was anterior to the lower part of esophagus. Of course, you have the right lung and the pleura on the right, and left lung and the pleura on the left. Especially in this upper part and in the lower part. I think that's, I would say, more than enough. And please, if you have any question, we are listening, guys.